Imagine the invisible landscape of human suffering. Suddenly, the brain's pathways light up with these violent, glowing bursts of orange and yellow. Welcome to this explainer, where we're going to explore the absolute limits of the human nervous system through the groundbreaking work of neurobiologist Dr. Elias Thorne. For 20 years, Dr. Thorne has been compiling what he grimly calls the Atlas of Agony. He's basically been documenting conditions that push the human body to the very brink of sanity. We're going to map out the exact moments when our biological alarm system undergoes a total catastrophic collapse.
Okay, let's dive into this. Because pain, well, it's supposed to be our protector, right? It's the reason we actually survive childhood, the reason we don't accidentally leave our hand resting on a hot stove. But Dr. Thorne presents a truly terrifying mystery. What happens when this perfectly designed, incredibly vital evolutionary alarm system just completely malfunctions? What happens when it encounters a threat it never evolved to handle? Well, pain transforms from a reluctant guardian into an absolute tyrant. As Dr. Thorne puts it, pain is a paradox. It stops being a mere symptom, and it literally becomes the disease itself.
So to really understand the malfunction, we first have to understand the baseline, and that brings us to nociception. Picture these microscopic, glowing wires spreading all throughout your body, ending in these specialized sensory receptors. Now, these receptors, they lie completely dormant in our skin, our muscles, our organs. Think of them as sleeping guards. They only wake up when a stimulus is intense enough to cause actual physical tissue damage. Section 1. The paradox of pain, biology's reluctant guardian. Let's see how this protective system actually builds. Before we completely break the whole thing, we need to see how a healthy nervous system perfectly categorizes structural threats. Say you accidentally prick your finger with a needle. Boom. That sudden stimulus activates your A delta fibers. Notice how thickly insulated they are with myelin? That insulation allows them to shoot a super fast, sharp warning directly to your brain, so you pull your hand away instantly. But if you suffer a lingering burn, your body activates its C fibers. These guys are unmyelinated, meaning they lack that thick insulation, which results in a slow, throbbing ache that basically reminds you to protect the injury while it heals. See? The system works perfectly. But now, let's completely break it. Section 2. Chemical fires and internal vices, the exogenous attack. We're taking our first step down into the abyss. We're going to look at what happens when outside forces, like exogenous chemicals, hijack these perfectly designed fibers and force them to fire relentlessly. Now, what's really interesting here is looking at the Schmidt-Sting Pain Index. A fire ant is a mildly alarming 1.2. A yellow jacket, that's a hot and smoky 2.0. But look at the absolute extreme at the bottom. The bullet ant stands entirely alone at an unprecedented 4.0 plus. Entomologist Dr. Sarah Jenkins encountered this terrifying insect deep in the Amazon basin. When it stung her thumb, she didn't just feel a throb. Her vision literally went white, she lost control of her legs, collapsed in the mud, and actually begged her colleagues to chop her hand off with a machete. I mean, can you imagine? And why? All because of a microscopic chemical lie. Let's break down this poneratatoxin protocol step by step. So the bullet ant injects a neurotoxin called poneratatoxin. Now, normally, our nerves' sodium channels open up to send a pain signal, and then they quickly snap shut. But poneratatoxin acts like a molecular wedge. It specifically targets the NaV 1.7 sodium channel and locks it completely, permanently open. The nerve literally cannot reset. It fires at maximum volume again and again and again. The somatosensory cortex and the amygdala are screaming that the hand is currently melting in a blast furnace, even though structurally the hand is completely fine. This chemical torture can last for 24 brutal hours, and standard painkillers do absolutely nothing. But an attack doesn't always have to come from the outside, right? Consider John. He's a strong construction worker, but he was brought to the ER completely sobbing in the fetal position. Why? A kidney stone. While they're small, under a microscope, these stones are essentially clusters of jagged calcium oxalate razors. As one drops into the ureter, the smooth muscle totally panics, initiating these violent, uncoordinated spasms. But here's the crazy biological twist. Our visceral internal organs don't really have many standard pain receptors, so their distress signals travel via those slow C fibers we talked about earlier, which happen to converge in the spinal cord with skin nerves. The brain gets utterly confused. It completely misinterprets the distress signal as this crushing agony radiating outward through the back and groin, a phenomenon called referred pain. And because it's connected to the vagus nerve, it induces extreme nausea. It is quite literally the body trying to birth a razor blade.
Section 3. When the hardware misfires, the suicide disease. While chemical fires and internal blockages are agonizing, biological pain is generally finite. It ends. But now we enter a much darker, much more terrifying realm. What happens when the hardware of the body turns against itself? Neurological pain is boundless. Take David, for example. He's a 42-year-old architect who suffers from cluster headaches, medically known as trigeminal autonomic cephalalgias. In the medical community, they carry a highly grim nickname, the suicide headache. Deep in the brain, the tiny hypothalamus misfires, triggering massive blood vessel dilations right behind one eye. These expanding vessels physically press against the trigeminal nerve, which is the largest, most complex sensory pathway in the human face. The nerve basically panics, dumping highly inflammatory neuropeptides, like CGRP, directly into the surrounding tissues. David describes the horror of this 2 a.m. routine directly. He says, "Suddenly, a red-hot, serrated hunting knife is shoved through my right eye socket. The pain is so neurologically electrifying that you cannot keep still." Unlike a migraine where you just want to lie perfectly still in a quiet, dark room, cluster headaches force patients to pace like caged animals. Sometimes they're literally beating their own heads against brick walls just to distract the brain. Striking at exactly 2 a.m. for weeks on end, the sheer anticipation of the beast returning causes severe PTSD. It's an internal inferno, but with absolutely no physical wound. And that trigeminal nerve, it can fail in other catastrophic ways, leading to trigeminal neuralgia. Imagine Alina. She's a 60-year-old teacher, and she is absolutely terrified of a gentle breeze. Over the years, a pulsing artery has been beating against her trigeminal nerve, slowly wearing away its protective myelin sheath. This creates what's called ephaptic transmission, or crosstalk. Think of it as an electrical short circuit. When a light breeze just grazes her cheek, that gentle touch signal literally jumps the tracks directly into the bare pain pathway. A harmless breeze blasts thousands of volts of phantom electricity right through her jaw, paralyzing her in an agony so absolute it wipes her mind completely blank. She becomes a prisoner of the open air. Section 4. Total meltdown, corrupting the flesh and mind. We are now approaching the absolute summit of the McGill Pain Index. The conditions we're about to explore represent the central nervous system undergoing a total nuclear meltdown. Look at this staggering number, 42 out of 50. On the McGill questionnaire, a score of 42 is higher than non-terminal cancer. It is mathematically higher than an amputation without anesthesia. This terrifying score belongs to a disease of paradoxical horror, complex regional pain syndrome, or CRPS. Let's look at Marcus. He was an athlete, sprained his wrist. Normal, right? The tissue healed, the bone was totally intact, but the pain just multiplied. In CRPS, the initial injury heals completely, but the spinal cord's NMDA receptors undergo a malignant transformation. They become wildly hyperexcitable. It's like an amplifier getting permanently stuck at maximum volume, a bizarre phenomenon called wind-up. For Marcus, profound allodynia sets in. If a soft cotton bedsheet touches his arm, it registers to his brain as sandpaper scrubbing a third-degree burn. If someone merely drops a heavy book in the room, the sudden sound triggers a rush of adrenaline. That adrenaline physically binds to the pain receptors in his arm, setting it ablaze. And, most horrifyingly, the disease can spread. The brain's physical map of the body, the homunculus, literally distorts and smears over time. The brain completely forgets where the pain is even coming from. So, the absolutely crucial point here is that systemic overload shatters the mind. We see this mechanical violence perfectly mirrored in severe thermal trauma, specifically during burn debridement. Maya, a chemical plant worker, barely survived massive third-degree burns. But the true agony wasn't actually the fire. It was the life-saving treatment that followed. To prevent fatal sepsis, necrotic tissue has to be aggressively scrubbed away. When tissue is destroyed, it spills this toxic chemical soup that dramatically lowers the activation threshold of the remaining completely bare nerve endings exposed to the open air. During daily hydrotherapy, as rough medical sponges scrub the dying flesh, the massive influx of pain signals spikes Maya's heart rate to 180. The body enters a hypermetabolic state, literally burning away its own muscle mass, just to sustain the sheer energy required to endure the horrific mechanical torment of those medical instruments. Section 5. The Venom of Doom, Irukandji Syndrome. We're shifting now to a really bizarre outlier in Dr. Thorne's atlas, a condition that blends crushing physical trauma with profound psychiatric horror. And it's brought on by a creature only a few millimeters wide, the tiny Australian Irukandji jellyfish. The initial sting, it's barely a tingle. But 20 minutes later, a biological time bomb detonates. The venom crosses the blood-brain barrier, executing an act of total biochemical terrorism. It forces a massive systemic dump of the body's entire reservoir of adrenaline, noradrenaline, and dopamine, all at once. Blood pressure skyrockets to stroke-inducing levels, muscles lock into these excruciating, paralyzing cramps, and the lungs actually begin to fill with fluid. But it's the psychological symptom that is truly deeply chilling. The venom completely hyperstimulates the amygdala. That's the deepest fear center of the human brain. This creates a documented clinical medical symptom known simply as a feeling of impending doom. One toxicologist described this hyperstimulated amygdala perfectly. I looked at the ER doctor and told him with absolute conviction that my soul was leaving my body. Patients don't just feel pain here, they experience an absolute crystalline certainty that they are going to die in the next few seconds. The dread is purely chemical, but it strips away all logic. Victims routinely beg doctors to kill them, just to end the cosmic, suffocating terror of mourning their own death while still breathing. And this brilliantly illustrates the dark majesty of our nervous system. But it also brings us to the most massive twist of our explainer. We've seen the absolute horrors of the alarm malfunctioning, of it ringing endlessly. But what happens when the fire alarm never rings at all?
Section 6. The Curse of No Pain. Congenital Insensitivity.
We bring Dr. Thorne's research full circle by looking at the exact opposite of everything we've explored so far. The profound curse of feeling absolutely nothing. Remember the entomologist and the bullet ant? Its venom locked the Nav1.7 sodium channels wide open, causing pure, inescapable agony. Well, due to a highly rare genetic mutation in the SCN9A gene, a child born with congenital insensitivity to pain, or CIP, has Nav1.7 channels that are completely non-functional. They literally cannot feel any physical pain. At first glance, it sounds like a literal superpower, doesn't it? But the reality is, it's a painless death sentence.
Without our cruel, yet completely necessary guardian of nociception, trauma just accumulates completely unnoticed. Dr. Thorne's files somberly detailed children who have unknowingly chewed off portions of their own tongues while teething. They'll place their bare hands on glowing hot stoves, entirely oblivious as their own flesh chars. They walk on fractured tibias until the bone actually splinters through the skin, leading to chronic, devastating bone infections like osteomyelitis. Heartbreakingly, individuals with CIP rarely survive past their 20s, because without pain, they destroy themselves without ever even knowing it.
Which leaves us with this final, truly profound thought. We have mapped the absolute extremes of human suffering today, from the relentless chemical fires of the bullet ant to the terrifying electrical storms of the trigeminal nerve. The human nervous system is clearly capable of generating a symphony of unspeakable suffering. But isn't it absolutely incredible that the very agony we fear so deeply is the exact, delicate biological tether that's actually keeping us alive? Our patients today survive sensations that should theoretically shatter the human mind, showcasing just unbelievable human resilience. So the next time you feel a sharp ache in your back or a sudden throb from a stubbed toe, maybe, just maybe, you'll be profoundly grateful for the everyday aches and pains of your fragile, resting, living body.
Please like and subscribe.